And we're in. Beautiful, beautiful. That's what I'm talking about. Let me go ahead and edit this baby. Cameron Gordineer. Perfecto. Who? Ah, perfect. I'm live. Cameron is trying to connect now from Bloom Healthcare. And we're gonna have some fun. Oh yeah, hit that like baton. Where in the world's mine? Yeah, 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 yeah. Booyah. Good evening, my friend. How are you this wonderful day?
I'm doing pretty good. How are you?
I'm doing great. Excuse
Excuse
me.
me.
I
I
completely
completely
clicked the
clicked the
wrong
wrong.
thing.
What was that?
There we go. I completely clicked the wrong thing there for a
Oh,
second.
it's all good. Can you hear me okay?
Cameron Gordineer from Bloom Healthcare. We are happy to have you. Extremely, extremely so.
Thank you. Happy to be here.
Is there anything you'd like to tell our audience as an introduction?
Yeah, sure. My name is Dr. Cameron Gordineer. I'm a chiropractor with Bloom Healthcare Group. We are a clinic in Glen Carbon that we have primary care, chiropractic, weight loss, and aesthetics that we like to help our patients with in the area.
That is lovely. Now, how long have you been a licensed chiropractic professional?
It's been a little over 2 years now.
Man, I mean, you are pretty young. It makes sense that you're pretty new to it.
Yep. Yep, it is it's been a whirlwind. I don't know if you just heard that loud crack of thunder. But yeah, it's been awesome. It's been a long time coming. I've wanted to be a chiropractor since I was in high school. Um, so it's definitely been long awaited, but yeah, it feels great to finally be able to get out there and help people in the world.
Bloom Healthcare. Is that just the brand of the building, or is that an entire system? Or is it a franchise?
It's we technically have two locations, but they're managed separately. Um, but it is kind of a newer thing. The business itself has been around for probably 11 or 12 years now. Um, and but recently I just joined on probably about 2 months ago now. But we're really trying to rebrand it more so towards the Bloom Healthcare Group. It used to be Advanced Medical Weight Loss. Um, but yeah, they wanted to do a little bit more holistic care. They noticed that their weight loss patients needed a little bit more support, both physically and nutritionally. So they wanted to bring on me to kind of be a little bit of a patient coordinator, talk to the weight loss patients if they were experiencing any pain, help them with chiropractic side of things, and then also kind of give them nutritional advice and make sure they weren't um, didn't have any nutritional deficiencies or were getting all of the, right stuff in their diet.
Lovely. So you're taking nutritional health, holistic health, and of course, chiropractic well-being, which targets the central nervous system. Actually, I'm going to take this time to remind our viewers, if you have a question, please feel free to send it in the chat. Somebody asked if alcohol helps your back. That was a Simpsons reference. These guys are goofy.
That's all good. No, I mean, it'll maybe turn off some of your pain receptors, but it definitely won't fix that long term. There's a lot of remedies in the world for things, but there's very few things that actually fix the problem, for sure.
Now, my friends, Bloom, Gordineer, I have a question. My first question of this interview concerns the current state of healthcare, as will be a major theme going forward. As you are a healthcare professional, and you've been seeing these cuts to programs addressing chronic diseases
Yeah.
such as diabetes and cancer, mental health, such as taking down of the suicide hotline and firing mental health professionals, and of course, addiction. What strategies would you recommend to maintain a focus on preventative care, as that is a type of care that you give at the local level?
Yeah, that's a really great question. I think it's honestly a shame the way that our government is tearing down services, especially to help those that, are in situations of pain or addiction or mental health crisis. I think that those are the people that kind of need the most support that we can offer. My goal as a healthcare provider is really to empower people. um, I think that medicine is fantastic for what it does. I think it's misused a lot in our society. Um, you can't even really get a cut on your finger without thinking about taking like an ibuprofen or a Tylenol. I think medicine has become so ingrained in our lifestyles to our own detriment. I think it's kind of hard to say that medicine is bad or anything like that. Of course it's not. Of course it, helps a lot of people. But, with drug commercials and different types of, you know, media campaigns and things like that, I think it's just gotten to a point where we don't even know what medicine is for anymore. Um, and so my job is really to kind of not just fill that void that medicine is not preventative. It in no way is able to prevent something from occurring, but medicine is great when something is already occurring. In some instances. Of course it depends, what's going on and all those things, but when they say, oh, we're going to be preventative, but then you also have patients that come to me and they say, well, my doctor said it's not bad enough yet, so they're just gonna wait and see what happens. That's to me, that's not preventative. That's kind of the exact opposite is waiting for a problem to happen. Um, but I think that it's very important that because I know a lot of chiropractors get the rap of, hating medicine or anything like that. It's not that at all. It's very much we know what medicine should be used for, and we know that people are overusing it, and it doesn't really seem like the pharmaceutical industry really cares that it's being misused. Um, so really, as a chiropractor, our goal, like you said, is to support the nervous system. Every cell, every tissue, every organ, every function in your body is controlled by your nervous system. Um, our the main thing that protects our nervous system is the spine. So it makes sense that we see it, and we know that it works this way. When there is a problem in your spine, it will affect your nervous system. It will decrease the nerve's ability to output signals, and it will cause you problems. Um, and so my goal is not just to look at you and say, okay, you have pain. I'm going to diagnose you with you have low back pain. I'm going to diagnose you with lumbago, which just means you have low back pain, because that's really all a diagnosis is. Here's a drug, go take it. I want to know why your back hurts. I want to know, of course you probably had an injury, but if you didn't, what else is contributing to it? What caused this problem? Even when you look at like high blood pressure, high cholesterol, all of those things have dietary uh uh,
Implications?
implications. Yeah, absolutely. But it also stands to reason, your body was designed in a way that it should function normally on its own unless it's interfered with in some way. So when we're not seeing that normal function, we really should be asking ourselves, what is going on? What is preventing this from happening rather than just trying to deal with the symptom on its own. I hope that answered your question.
Oh, yes, I believe so. Now, given these cuts, there might be a lot of holes in our healthcare system. I want to ask you, as you've been in this field for 2 years, you've been seeing it take place. How do you see the role of chiropractors evolving as a traditional healthcare system? Do you believe that you would be able to fill the gaps in preventative care?
For sure. I think that's without question. I think the hardest thing about um, being a chiropractor is because it is preventative. We can't say, well, I adjusted this newborn baby, I prevented them from having XYZ disease, condition, whatever, because we don't know what could have happened. We don't know what could have happened if that child went unadjusted. Um, but we do know that when problems do occur as well, not even just from the preventative side, but also, you know, in the aftermath, we also know chiropractic is great for that too.
Mhm.
I think that the cuts to, all these programs and stuff, it's 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 going to weigh very heavily on an already injured system. I don't think that our medical system has been running well ever, maybe.
Mhm.
I think it's it's really a disservice to the community and especially small local communities. There are towns, especially in rural areas that they don't really have great access to things. That was already an issue, and now we're cutting all of these programs and really preventing people from getting the help that they need when they need it. Um, I really hope that chiropractic is able to fill that void. I hope that people will turn to alternatives. I think we're at a point right now where I think people are kind of starting to realize, hey, like this isn't really helping, especially with people with chronic conditions that, they've tried everything under the sun and they're just sick and tired of feeling sick and tired all the time. We're not our food isn't at the quality that it should be. A lot of people are more sedentary nowadays. But on top of that, they're also, just taking medication after medication after medication for symptoms that were caused by the first medication. And I think people are starting to realize that that's not really fixing anything. Um, and I hope that people turn to chiropractic or at least learn about chiropractic before they, go to extremes or anything like that. Um, but I do hope, I know there are chiropractors in the profession that would like to be more of a medical model or, fit in with medicine and all that stuff. But I think what the most important aspect of being a chiropractic is our philosophy towards health, our philosophy towards how the body works. And you can't have a chiropractor with a medical philosophy. It just you have to understand why you are doing what you are doing, what your goal of an adjustment is, and the only way to do that is by knowing chiropractic philosophy, because when you try to just treat it like you're giving somebody a medication, it will not work. The body is a fantastic, which is why most of them are very successful. The body can kind of take what it can when it gets it and it'll make do, but to really change people's lives, I think it's important to remember, there is a rhyme and reason to it. And we do know how the body works. We know it's the same body. It's been around for centuries. We haven't changed much in the way that we function in the last 200 years. Chiropractic has been around since the 1800s. It's it's the same now as it was then. A lot of people want to change it because they want to, update things and all that stuff. But when you really boil it down, like I said, the body hasn't changed. It's been functioning the way that it functions for thousands of years. And so I don't really see the need in chiropractic itself to change. Of course, the tools we use and the diagnostic equipment will change as we get improvements, but the philosophy behind it is the philosophy behind it.
Hmm. That philosophy actually leads me into my next question.
Awesome.
Chiropractics as a profession has a very unique standpoint, commonly put in between traditional medicine and what is considered the practice of medicine.
Hmm.
So given the situation right now, as in people becoming more skeptical of science in general, people becoming more distrustful of things such as vaccines, of
Right.
doctors, of actual medical practices. How do you handle misinformation about health within your practice? And what role do you believe chiropractors should play in promoting evidence-based health education?
For sure. Um, I think one of the biggest things that hurts our profession is the use of social media. Um, Not just in people posting random things or, you know, I, in my beliefs, I firmly believe that you should not give medical advice or healthcare advice to people that you do not know. Um, with the spread of misinformation, like I would never, like, without seeing a patient myself, without talking to them myself, understanding what their health risks are, um, and doing like an exam on them, I would not give anyone advice, you know? And so for people of any profession, is doctors of any profession to be on the internet spewing, you know, what they believe is the truth or whatever, um, I don't think I think it's absolutely unnecessary for us to be doing that. If people want medical advice or they want healthcare advice, they should see somebody for that, you know?
Mhm.
Um, and so I think that as a profession, like that has not done us well. But I also think, there are dangers to vaccines, and of course, we should question things that you want to put in your children and all that stuff. But I do think I cannot give anyone advice on what they want to do with their body unless they come to me and ask me for advice.
Mm.
Um, as far as, chiropractic not being seen, as, you know, a, s- uh, a scientific thing or anything like that, or, um, we've been called wax and all that stuff, but, if you genuinely look at the history of it, there was a lawsuit, I think sometime in the 1900s, I think maybe around 1910, I think it was, um, where the American Medical Association was found um, responsible for having a committee. It was called the Committee on Quackery, and their goal was to discredit chiropractors because they were afraid that chiropractic was going to take patients away from them. So they started this committee and ran propaganda campaigns to kind of make chiropractors seem like fools, like idiots. And we're still dealing with the ramifications of that today. But at its core, chiropractic is three things: a science, a philosophy, and an art. The science, I think we've unfortunately gotten away from it in of what I would like to see. The technique that I do is called Gonstead, and what I absolutely love about it is it is very much towards the science part of it. When chiropractic was created, they were trying new things. They were trying to understand how the body works. So they were doing, you know, trials and all these things on patients at their clinics. They were testing their theories and all that stuff. But today you go on, TikTok and all that stuff, and you just see chiropractors popping people up, down, left, right with no real rhyme or reason. And so what I really like about the Gonstead system is we try to remove as many variables as we can. There's as little guesswork as possible. In fact, I would stand to say there's almost no guesswork involved. It is very much it's more objective. We don't adjust as many segments. I would maybe adjust 3 max on any given visit. I prefer to do less because really the more variables you remove from the equation, the more likely you're going to understand what happened. If I'm, popping people left, right, up, down, and they come back the next day and they say, "Oh, hey, that really helped. Do that again." Well, I don't know what I just did to you the last day. I can't remember exactly where it was or what I did. Sure, I write it down in my notes, but if I'm just doing broad contacts and I'm not doing an exam beforehand, I don't know which way I push it. I don't know, exactly how I did it. And then on the other hand, God forbid they come back and they say, "Hey, that really, really hurt," or, that I feel worse, don't ever do that again. Well, what did I just do? I don't know. And so with Gonstead, we take measurements. We use heat sensitive instruments to tell us where the body has inflammation because inflammation brings heat. We use the body's physiology as a way to understand what's going on and monitor it. So that way we can not only tell you exactly where you need to be adjusted, but we can also say when you are done being adjusted because that's the goal of an adjustment. It's not to keep adjusting you over and over and over and over again. You should eventually get better. You know what I mean? Unless you are in a position where, you're constantly re-injuring yourself with like repetitive tasks at work or, different things like that. But the goal of chiropractic is to make you better, is to remove the subluxation or the interference with your nervous system. That's the goal. People will be like, "Oh, well, I don't want to get hooked for life." If you're seeing a chiropractor for life, that's a good thing. Everybody should be seeing a chiropractor, genuinely. But you should not be seeing them, in a sense that, they're just doing the same thing over and over and over again. They should eventually, at some point, tell you, "Hey, you don't need an adjustment today." Of course, with everything, there are rare cases where, people have really, really chronic problems. And it takes an adjustment every single time for, 20 years just to get them feeling okay. But at the same time, those are the outliers.
Mm.
If you see a chiropractor and use chiropractic like we should be using medicine, appropriately, really, you would come to a chiropractor before you have a problem. That would be the ideal way to go about things. You come before you have a problem. It takes one maybe adjustment, catch it before it's a real problem. Or, you come in when you start feeling a little hurt or, something starts aching and you don't let it become a chronic problem where there's not enough disc material in order to like heal that area properly. What takes you to destroy in a day can take you years to regain. They say Rome wasn't built in a day, but it burnt down overnight,
Mm.
and so when we're trying to rebuild and like restore what has been lost, it's so much easier to help people get back to at least, 99, 95, 90% when they come in before it becomes a really, really chronic problem. Because when that happens, it's really a matter of, the adjustment isn't healing you. That's not the goal. The adjustment is removing that interference and allowing your body to heal yourself. So the limit you have on how well you heal is time. That's the only, real barrier that we have is how much time has gone on since you've had this injury. How long do you think it's going to take? And then, of course, your age, well, as we get older, our metabolism slowed down. We're not able to heal as quickly. And so, like, the longer you go on, the older you're getting, and it's just kind of these compounding problems that make it a lot harder to, to really, see the full benefit of chiropractic.
Hmm. Now, what are your thoughts on how healthcare funding cuts disproportionately affect the most marginalized communities? You mentioned earlier that these do affect areas that are less affluent,
Yeah.
that are more rural, that have less, actually, that have more poverty
hmm
because they have less access to healthcare. Now, how do you believe that these attacks on the healthcare system are going to affect them, and how can you, chiropractors, advocate for equitable access to care?
Yeah, I think you hit the nail on the head. You're exactly right. It's usually when we see these sweeping cuts like this, or you know, defunding of anything, that it rarely ever affects the people that have disposable income, right? Because they're not as worried about accessing these services as compared to people that rely on them every day just to survive. Um, and that's really, you know, the disprivileged and people that have not, you know, weren't born with, people that had money, or they, are in circumstances themselves, whether they've been put there through the medical system where, they were injured and now they have medical bills that are burying them, or even if, you never had money in your life. People don't understand that um, you know, changing your economic status isn't easy in the slightest bit. Um, and in some cases it's absolutely impossible. You need a driver's license to be able to drive and have a car. But to buy a car, you need money. And to get your license, you also need a house and you need an address. There are barriers to access that some people never have the fortune of, overcoming. And so when we look at these attacks on the healthcare system, it is genuinely those people that are suffering the most that are going to be hurt the most by these policies. Um, as chiropractors, we are in some ways considered non-essential health services, which is unfortunate. I hope that that will change in the future. And so when people are on hard times, we are typically one of the first things that, medically wise, if they cannot afford to come, they'll stop doing so. I mean, I'll have patients like that know better and that have learned what chiropractic is and how it helps them. And, they'd rather cut, you know, seeing their primary care provider every 6 months, or something like that. It's very much like when money is a problem, it is usually what that person prioritizes, what they value, that, they'll end up make either, doing what they can to afford it, or, or cutting it loose. And so it really is a matter of, their view on what is helpful and what is valuable to them. But I do hope that, oh, I'm so sorry. Sorry about that. I do hope that as time progresses here, that that chiropractic is able to be seen by as more of an essential service, and I hope that chiropractors as a whole are a little bit more lenient on patients. I think, when I have not met a chiropractor that has not been giving some, level of care out at a discounted price or anything like that. I think that chiropractic is rare in the sense that, most people that if they own their own, I'm so sorry. I don't know why it keeps going off. Let me mute this. Um,
Don't worry, I also have an alarm that goes off at the worst times.
oh no, it's my fiance calling me. She's on her off work now.
Aw.
Okay. All right. So, but as I was saying, I think it's important to have options for patients to be able to afford care. You know, Bloom, one of our goals or in our philosophies at Bloom is that we will not let patients' financial situations keep them away from the care that they need. We have, financing options and things like that because we know that regardless of your ability to afford something, you still need the care that you deserve. And so it's, you know, our privilege of being able to help some people in that sense. And it's our kind of our charge to do so. I don't think anybody should be denied care if they can't afford it. Um, there's always payment options or different things that you can discuss.
I agree. I agree wholeheartedly. There are a lot of there are a lot of fear associated with the healthcare system in our current climate, and there always have been. That's the reason why healthcare has been a very popular and very widely accepted concept of our politics. Of course,
Yeah.
we still don't have decent access yet, but we're still making strides. Hopefully, we will do so going forward rather than regressing. But my next question is actually more personal,
Yeah.
because you mentioned early on that you've wanted to be a chiropractor since high school.
Yes, sir.
Therefore, my question to you is what inspired you to pursue chiropractic care as a profession, and how has your view of the healthcare system changed since you started practicing?
Yeah, that's a good question. My answer is kind of twofold. When I was in high school, I started getting really bad headaches. And my mom has rheumatoid arthritis. And so, like, at the time, whenever we had to, like, go places or, we went on trips or anything like that, or even if we were just, like, walking around for longer periods of time, my mom would always have to use a cane. And so when I was in high school, um, I started, we kind of talked about going to see a chiropractor together. And so we were like, all right, let's go and check it out and see if it would help at all. As for my mom, she has been going religiously into a chiropractor ever since, and she has not touched a cane ever since. It just helps her feel better, helps her move better. And she doesn't have, of course, as she's getting older in age now, it's, getting a little bit harder. But at the same time, it's given her so much of her life back in the past, I don't even know, 10, 15 years. um, and then as for me with my headaches, um, chiropractic when I was in high school and college, it kept my headaches away. I went to a couple different. I've been to probably a handful of chiropractors. I've been to physical therapists, couple primary care doctors, a neurologist, all of those things. Chiropractic was the only thing that really kind of kept them at bay. I was prescribed a couple different medications. One of which was when I was in chiropractic college, um, and it had made both of my hands like not numb, but like I could not feel the tips of my fingers. It felt like it was like an inch from where it was supposed to be. And I was like, well, that's weird, that, and on top of that, I still had a headache. So I
Oh.
was like, this isn't even worth it. And I was like, I kind of need my hands to be a chiropractor. Um, and so then it was around that time that I learned about Gonstead, and I went and I saw his name's Dr. Richard Cranwell. He's been a professor at Logan for over 45 years now. He was one of the last interns that Dr. Gonstead himself had up at the Gonstead Clinic, which was in Mount Horeb, Wisconsin, middle of nowhere. But he successfully built one of the largest chiropractic clinics in the world at the time. Um, and so Dr. Cranwell had trained with Dr. Gonstead for several months. And he lived at the Gonstead Clinic while he was up there. Came back and decided he wanted to teach at Logan. And he taught Gonstead at Logan now for, I think, 46, 47 years. But anyway, I learned about Gonstead. I went and I saw Dr. Cranwell. And within 2 months, I stopped having headaches.
Hmm.
To this day, I rarely get headaches, as long as I'm adjusted regularly and I, obviously drink water and all that good stuff. But yeah, it's chiropractic has changed my mom's life. It's changed, my life. My sisters both see chiropractors, Gonstead chiropractors as well. And yeah, it's just been a fantastic experience for me, and I wanted to get become a chiropractor because I saw how much it helped with my mom, and I wanted to be able to help people kind of regain their lives. I think that's the most fantastic thing that I can do for people is that I can, help them get their lives back. You have no idea what kind of toll uh pain really has on you as a person, not just mentally, but in your relationships, in your day-to-day life. There is so much thought that goes into ignoring your pain that when it's gone, you don't realize how bad it's been until you start getting help from it. Um, and I see it with my own patients that a lot of them have pain for a really long time and they don't even realize it. I ask, how long has this been going on for? And they kind of you see the realization on their face of like, oh yeah, this has been like over 5 years. It just time flies when you're, suffering, honestly. But it also stands still because it feels like every day is forever. Um, but yeah, I just wanted to be able. I didn't like the way that the medical system kind of not treated my headaches, but very much, the entire time I just was like, this isn't, but why am I having these headaches? What is the problem? And they weren't able to answer that. That's kind of my answer.
Now, that is a very common complaint of our healthcare system that they see symptoms and then automatically think of a diagnosis without examination. In fact, a lot of our medical community controversies, especially in minority communities,
Hmm.
from Black and Native women being sterilized to Black women having a higher degree, to having a significantly higher rate of maternal death as a
Right.
result of hospital neglect, and Black men, on the contrary, being more susceptible to different cancers or strokes as a result of lack of screening.
Right.
Now, there are many, many controversies out there about the healthcare system, but I want to know how you feel about chiropractors and their representation in broader healthcare conversations and policymaking. Do you believe that chiropractic care should be more considered in policy making? Not the policies that are happening right now, not the, hey, let's get rid of this.
Right,
I'm talking
right.
about in general. Hmm. Should they be more regarded, more considered when it comes to actually making laws concerning people's health?
Yeah, you know, I think it's always a shame when any community is not serving the people that it's promised to serve. Um, I think it's a shame that it's not even a shame, it's a disgrace, really, um, that those, figures and those facts exist, that, women and women of color and men of color, like, that they are treated unfairly, not listened to, not heard, um, even on a subconscious level is just it's unacceptable. As far as chiropractic, on the legal stage, I think it's difficult for us to grab footing um, when we're up against, the pharmaceutical industry, really. Um, so I think that might take time to happen for us to have a decent sway with health policy and things like that. But I do know that when, you know, there are a majority of people that fight for things, it typically will eventually end up, you know, taking control, or at least, having some power to it. Um, but yeah, I think that's the one hurdle that really prevents a lot of things from happening in health policy is, these billion trillion dollar corporations doing their best to, know, make money over, the lives of people. I just think, we have to stop the greed and obsession with, power and all of those things, and really focus on the people that we're serving. Because that is, at the end of the day, like the one thing that we are tasked to do, even, as healthcare providers, but also as public servants.
Mm. And you mentioned very briefly the stigma around chiropractic care. You've mentioned it before,
Mhm.
but you even mentioned it in that last question. And I want to ask you if that stigma is something you're forced to deal with your patients and how you navigate it when you're trying to treat them.
For sure. Yeah, it's definitely it's become a kind of underlying thought that everybody kind of holds until they know better. Because I think that most people are raised under a medical mindset of things. And so when you meet people that have no idea what chiropractic is, or what it's for, or why anyone would ever do it other than like maybe low back pain, um, it is a little bit of a process to kind of get that person to understand that chiropractic is more than just about pain. Um, like we talked before, we are focused on the nervous system. Anything that could go wrong with your nervous system or your body in general, could have benefit from chiropractic. And the other thing too is that, not every chiropractor is exactly the same. And so like sometimes you'll have patients that have been to other chiropractors and they develop their mindset towards the profession from that experience, but they don't realize that there are over 100, probably over 200 different techniques within chiropractic. Um, and so not every chiropractor that you see is exactly the same. That's why it's important to not just research the clinic that you're going to, but also research the techniques that they use. Try to understand, it's difficult until you experience it, but if you ever do go see a chiropractor, ask them what technique they do. Do a little research on it. It doesn't hurt. Um, but it also doesn't hurt, if you've been to a chiropractor and you didn't see success, it doesn't hurt to look around and find something different. Um, but that's also part of um, playing an active role in your health for sure.
Playing an active role in your health. Let's see. I have another question about your patients.
Yeah.
Have you seen any patients who have had disparities, obstacles standing in their way, financial, time-wise, or otherwise, that have unfortunately impacted their ability to get care? And if so, how did you handle the situation in a way that was beneficial for everyone?
Yeah, of course. Everybody's got uh barriers or schedule problems or financial problems. Um, it's a pretty common occurrence. I think that the best way that I can manage it um is by making sure that, yeah, I tell all my patients it's really important that you're honest with me. If you're, hesitant about something, if you're unsure of something, or, you know, if you're, if this is really gonna, cause some strain on you in any way, like you need to let me know that, and we can kind of work together and figure out a solution. If you've got work, all these hours, or, you know, you got to pick your kids up from school at a certain time, or all those things. Like, we can find ways around things. My mentor, Dr. Cramwell, used to say, "Pain doesn't take a holiday," you know.
Mm.
Um, and so, like, I will be there for my patients when they need me. Um, and in order to do that, you just got to let me know, and we'll figure it out.
Hmm. I love that answer. And there's one more that I'm actually really curious about. What
Yeah,
is the most common problem from your patients that you've seen? The health challenges, that is.
yeah. I think I've gotten a pretty decent variety off to the start. But my kind of favorite thing, I guess, probably my most common too, is people that come in and they say, they've had this problem for X amount of years, they've tried everything under the sun. I really like helping those people because I know that the technique that I use is without a doubt the best way to address a lot of these common problems, because it's so, detail oriented. It's so specific and precise that we're actually able to get, let's say, other chiropractic methods or other, you know, adjustment styles get, 90% of the population better. Let's say that, you know, two of that percent of the percent left, um, let's say 2% is people that chiropractic isn't for, it won't help them. I think that the Gonstead system can get as close to 98% as you could possibly get. Um, like I said, like it can't help everybody. Obviously, there's nothing in the world that, is 100% effective. But
Mhm.
but I do genuinely believe that, even just from what I've seen, but also from, chiropractors that I have known that have been in practice for years and years and years and years, um, this system is one of the best at helping those people that just haven't been able to find help anywhere else.
People who haven't been able to find help anywhere else. Don't worry, I promise we're getting near the end, but that brings me to a different, more hypothetical question. Let's say that chiropractic care is implemented into the mainstream healthcare system. Do you believe that it would play a very large role in addressing chronic pain and addiction?
Oh, for sure. You would have less people being prescribed opiate medications that we know will cause addiction in a large percent of people, especially when considering chronic pain because no matter how many times they take that, their pain is still there. It's not getting rid of the problem. And the longer you take opiates, the more likely you are to abuse them, and the more likely you are to become addicted to them, whether you abuse them or not. And so I think that if chiropractic were in the mainstream, you'd have less people being prescribed these dangerous drugs. You'd have less people in chronic conditions to begin with, um, because they'd actually be correcting the problem when it first come came about. And that would be, kind of the ideal world of, having people come in before it becomes a big problem.
An ideal. I'm going to ask you about something that goes against the ideal. Do you know of any specific policies that have directly made it harder for your patients to prioritize their health or seek treatment? Policy changes or cuts, either one works.
Off the top of my head right now, I can't think of any specific one. I just know that, any stress or strain that you put on somebody about their health, it will leach into other aspects of healthcare. You know, if they're now no longer able to afford their mental health care, you know, they have to pull that resource from somewhere else because it's not like they no longer all of a sudden need that thing that they were receiving with those funded programs. They just have to reprioritize what they can afford. And unfortunately, a lot of times that means just cutting, that service out completely from their lives. And that, you know, of course, is the obvious answer for people. And I understand why they choose that because, what honestly, what choice do they have? Are you going to put food on your table or are you going to go talk to your therapist for an hour? You know, it's really, really, really horrific that people are being put in these situations where they have to make those decisions. Um, you know, if we're talking about the ideal world, it's where people can go and they can get the help that they need without having to worry about what type of impact that would put on their lives in other places. Um, I think that if we put more of an emphasis on public health, not just would the individual be healthier, but our communities would be healthier, and that would lead to, more involvement in all sorts of, public services and stuff like that. I think that because of the internet and our ability to see everything everywhere, whenever we want, um, it's kind of diminished what we see as our community. It's increased it in that there are more people that we consider in our community, but it's also kind of left us blind to the people that actually live right next to us. And those are the people that are hurting right now. And so I think, you know, I encourage people to volunteer where they can. Obviously, not many people, you know, you can't volunteer for certain like health services and stuff like that. You can't just become a licensed therapist and that stuff, right? Um, but I think that other programs are going to suffer. I don't think this is the end of the Doge cuts,
Mm.
that I see, in the future. So I think that we just kind of have to be strong and support each other and, fill those gaps in the best ways that we can until we can get these policies changed, and really make a difference in our communities. But yeah, biggest thing is just supporting each other and trying to make the best of what we can.
Mr. Gordineer, that is a great point. Speaking of supporting one another, we've also got to support one another under oath sometimes. You mentioned the Committee on Quackery.
Hmm.
That committee, formed by the American Medical Association, excuse my enunciation, in the 1960s to discredit chiropractic practices, which was sued in 1987
Mhm.
in the ruling that they had engaged in an unlawful conspiracy to eliminate chiropractics as a profession. And now I'm going to ask you to make your case. If you were sitting in front of a policymaker that was very skeptical about your practice, about holistic practices, about alternative medicine, about chiropractic care, how would you make your case and defend your profession against them?
Yeah, I think it'd be probably, when we look at economies, successful economies, um, they rely on people being able to spend money and make money, right?
Mm.
If we look at where chiropractic fits into a growing economy, you can argue that, when people feel better, they're able to do more, they're able to work more, they're able to buy more. Um, from a, you know, capitalist perspective, it's kind
Mhm.
of um, a no-brainer in the fact that, when people feel good, they're more likely to do things. And when we look at it on a smaller scale, within a community, if everybody's feeling better, everybody's functioning better, they're out of pain, they're not going to miss work, they're not going to, have so many sick days out because they're, hurting and in pain. Um, and overall it would support people in what they love to do, because there's a lot of people right now in the world that can't do the things that they love because of the pain that they're feeling,
Mm.
or the symptoms that they're having. And so, like, you cannot know what exponential benefit you will have in somebody's life when they're out of pain. And so, like, from a lawmaking perspective, to me, it makes absolute sense why you should prioritize the health of your community through chiropractic care, because we are preventative care. Um, we are really one of the only preventative care, aside from, nutrition, and a few other professions. Like, it it just makes sense to me in a way that, yes, sure, pharmaceutical industries won't have as much money lining their pockets, but, you know, we'd have more people in the community volunteering and doing the things that bring them joy, because that will ultimately bring everybody around them joy.
I had to make that exact same case when I went to nursing school in Fort Lewis
Yeah.
because we went during COVID, right after we had vaccinated all of Fort Sam Houston, we went to Fort Lewis and naturally we had to make our case against the anti-vaxxers. And I went up on that exact same tirade, but I was extremely passionate. I was banging on the table. You wear those masks, you get those shots, the symptoms go down, you go out and you buy stuff. Less people get serious symptoms and they can go buy stuff. They can go to school, they can take care of their children. And
Yeah.
then I actually caught COVID I and I did experienced symptoms, but I just kept my mask on,
Right.
stayed a little farther away. I still went to class, and I
Yep.
didn't get anybody sick at all.
That's good.
So, hey, when things work, they work, and when people feel good, they can still get stuff done. I wasn't engaging as much, but I was there, and
For
I was
sure.
taking notes. Now, enough about me. I want to know two more things. One, has there been a particular patient or an experience with a patient that has shaped the way that you view healthcare policy or inspired you to advocate for change in the system?
Yeah, I think honestly, going with, what I said earlier, it's not so much a particular patient or thing, but an overall experience that I see with all of my patients is just it's an entire change of them of their personality, going through care, especially the like really, really chronic patients that I see, like it is just eating away at them when they come in my door. And to be able to see them, you know, even like a few weeks, a few months after they've been receiving care, just seeing the weight that is lifted off of them, they're able to enjoy their lives so much more. And that's the most satisfying thing to me is really seeing that kind of shift in people and bringing them back to life almost.
Mm, mm, mm. Now that's something that you always love.
Hmm.
Now, there is one more thing that I've got to know. You
Yep.
mentioned the ideal multiple times throughout this meeting. So for my last question, I'm going to keep it short and simple. If there was one thing about the US healthcare system that you could change right now, what would it be, and why does it matter to you personally?
Oh, geez. That's a hard one. Um, I think the one thing that I would change about the medical system is its perception of, I guess, I guess the human system almost. I would like to change the perspective toward more of chiropractic philosophy in a way like rather than looking at a patient and just saying, "Oh, okay, you're having XYZ symptom, here's XYZ drug." Um, I'd really like to see the medical system ask more questions. I know that hospitals and things like that are constantly, um, you know, they have a lot of
Overrun.
weight overrun, yet have a lot of weight on them. They have got a lot of patients. It's a very stressful environment. And I get that. I empathize with that, but I think that we still have to be doing our due diligence. We still have to be asking the right questions and getting to the bottom of it. And I think that that would help with the health disparities that we see. Yes, you're seeing a lot of patients, but you have to remind yourself with every single one that that is an individual person. I think the worst thing anybody could ever do for a patient is think that they're lying to them. Um,
Mhm.
and yes, of course, some patients do lie. Um, but at the same time, you also should try to understand why they're lying. What are they trying to hide? You know, and with that, you know, what if they're not lying? I think it's always in our best interest to ask the questions and believe our patients when they say that they're in pain. Um, but also not just stop it. Okay, well, here's this, prescription medication. Um, but really understand, what is causing them pain. I think that that's the one thing that I would like to change.
Mr. Gordineer, we have learned a lot about how you think throughout this meeting, about access to care, about how one should treat people as people rather than statistics,
For sure.
putting people over money, eliminating disparities in the healthcare system, and of course, addressing cuts by filling holes until they're able to be closed completely.
Hmm.
I don't have any more questions for you right now, but is there anything else that you would love to tell our audience?
I would just say, if you're having health problems right now and you haven't considered chiropractic care, um, I would absolutely, you know, I think it would be in your best interest to look into chiropractic and give it a chance. Like I said, it's not just for pain. We see a lot of neurological problems and things like that. Um, So if you're experiencing any symptom, any diagnosis, I think it's, you know, it might change your life to try and chiropractic. Um, if it doesn't work, like I said, there are plenty of different techniques. Try them out. Um, but you are absolutely worth that investment. Your life is worth putting that investment in so that you can live to your absolute best.
And with that, I believe we bring the interview to a close. Thank you so much, Mr. Gordineer, for being on tonight.
Awesome. Thank you for having me. I had a lot of fun.
I look forward to seeing you soon. Are you going to be at the reset?
uh, Maybe. I'm not sure, but I gotta look at my calendar.
In that case, we do it every month, and I'd say it's a pretty decent way to vent. There are plenty of opportunities in this area to go out, to get in the community, and especially to learn about public policy, which relates heavily to healthcare.
For
So,
sure.
but I thank you so much for coming on here tonight. We need more medical minds out there. Not everyone can be Dr. Mike, but we need more people. Dr. Mike, do you watch him?
I don't know. Sorry.
Nah, not everybody's a YouTube head like I am.
That's all
But
good.
that's all I've got for you.
Awesome.
My
Well,
audience,
thank you
Mr.
again for having
Gordineer.
me. Thank you very much.
Godspeed and good night, Mr. Gordineer. You are loved, you're appreciated, and you will do amazing things.
Yeah, thank you. You too.
Goodbye, everyone. Delta out.